Welcome to the webinar, Introduction to the Community Health Worker Programs with Katy Valesky and the Homelessness 101 Training Project with Matt Leber. My name is Melissa Da Silva and I will be acting as moderator for today's webinar, a production of the National Healthcare for the Homeless Council with support from HRSA, Office of Special Population Health. Thank you again for joining us for this webinar, and I now turn the presentation over to Ms. Katy Valesky. Katy?
Welcome, everyone. I'll be starting this session today to go over a little bit about what the community health worker model is. Community health workers are known by many names, but they have some things in common. They share a commonality with the communities that they serve. I will also be talking about the roles of community health workers, and then Matt will talk more about Homelessness 101 and how you can start a train-the-trainer in your area. Traditionally, community health workers are members of the community that they serve. They may speak the same language, they may struggle with the same life experiences, or they may come from the same neighborhoods, and they may access the health care at the same location. The reason why different agencies use community health workers is because they create an entry into the community that's just not possible any other way. They come from a similar background, and they can infiltrate a community in a way that outsiders just can't. They also are better able to develop trust with the consumers because they do come from that same community and they do have similar life experiences. And they can mobilize services more quickly when that's needed. They also have a deep knowledge of what it is to navigate the system itself. They know the struggles and the challenges and the triumphs of the community, and that knowledge is helpful to the consumers. The last thing that they have that is probably the most important is passion. That's something that cannot be taught or learned in school, and it is developed through experience. The experience of struggle is what gives community health workers the passion to help others who are struggling through similar experiences. The overarching role of all community health workers is to serve as a liaison between those in this situation experiencing homelessness, but any other situation, and the larger community, identifying and utilizing strengths and resources and opportunities in the community to improve that community. In the HCH context, the major three roles for community health workers are, the first is outreach and enrollment, to identify those who are eligible for Medicaid and get them enrolled, and get them connected with a health home. Navigation is the second one. Some of the paperwork and translation and all of the different issues that many of us may take for granted requires some coordination from an assistant, and a community health worker can really help with that. And the final one, the one we're going to be talking about today, is community advocacy and education. So this one is where community health workers can identify needs in the community and come up with ways to address those needs in a creative and new way to improve the entire community, not just those in need. With that, I'm going to pass it over to Matt Leber so he can talk about one of those opportunities that's recently been used in Nashville. Welcome, Matt.
Thank you, Katy. Good afternoon and good morning to those on the West Coast. This is my first webinar, but I'm excited to have a chance to talk with everyone here. This presentation is going to be about a Homelessness 101 training, which is led by consumers, homeless outreach workers, community health workers, and they're co-facilitating a workshop to law enforcement officials. And we found in Nashville, Tennessee, that this model has been something that's increased awareness and consciousness amongst law enforcement to increase the possibility of getting homelessness into housing and to decrease criminalization. And so I'm going to start, before getting right into the workshop, just share a few elements of what I think we all know who are on this call together. For example, we all know that access to housing prevents and decreases homelessness. It increases the quality of life, and it decreases criminalization of homelessness. A lot of the criminalization that I'm referring to is the quality of life ordinances that often people who are just surviving on the streets trying to survive get criminalized because they're looking for a place to sleep or a place to call home. And we also know that as we access preventive health care services, that also decreases homelessness. And being homeless increases the likelihood of criminalization. And that increase of criminalization costs everyone. It costs folks on the streets, it costs our providers, and it costs taxpayers. And so our goal is to decrease that. And before I get into the training, I just want to share that hand in hand with any training that we do, we always want to make sure that our cities and municipalities, we are working to create a coalition that advocates for the increased funding for housing, for healthcare, and outreach at the local, state, and federal level. And then also to stop policies that continue to decriminalize the poor, as I said, such as quality of life and panhandling ordinances. This type of work is absolutely critical as a bedrock in the education work that we all do. So as we look at this, we first want to look at the strategy of homeless outreach. What is homeless outreach? We understand that it's when folks go to where people are at who are struggling with homelessness and to hear what their situations are and help them at that point. Now, who are the outreach workers? Well, I've found in my time in Nashville with the Nashville Homeless Power Project that homeless individuals, consumers themselves, are the folks who are the best resource for other folks who are new to the streets. They know where to find food, where to find the clinic, where to go to get help, and often are there as a support system for each other. So I want to just acknowledge that community health workers, who are often homeless individuals, are the #1 resource. And then, of course, we have trained homeless outreach workers, individuals through congregations and other agencies. But then there's also the law enforcement, police officers. In Nashville, Tennessee, what we found is that other than homeless individuals themselves, the police interface with folks on the streets more than any other entity. In Nashville, there's 150 police officers for every 1 homeless outreach worker. So, and we also know that because many neighborhood associations and business associations often put a lot of pressure onto the law enforcement to crack down on the homelessness issue. And so what we're hoping to do with this Homelessness 101 workshop, which brings consumers, outreach workers, and law enforcement together, is really to put a real face on homelessness and reverse that trend that treats law enforcement as a system that often criminalizes homeless folks, and rather reverse that trend so they can be a force to help transition folks into transitional housing, permanent housing, and to get services that they're so critical. So in 2004, the Nashville Homeless Power Project, which is an organization led by homeless and formerly homeless individuals, created Homelessness 101. Homelessness 101 is an interactive workshop. It's really an exciting thing. It can take 3 hours, a half day, or a full day. What we do is we get 5 or 6 folks who've been homeless, 5 or 6 outreach workers, and service providers, and about 20 to 40 law enforcement officials. We put ourselves in a room together, as I said, for 3 hours or more, and we build relationships through a whole variety of activities. What this requires for you to do it in your own county or city is to have a point person who's a workshop coordinator with the law enforcement, 2 to 3 people who are willing to commit to a design and implementation of the Homelessness 101 workshop, and at least 1 or 2 of those who are currently or formerly homeless individuals, and then connection with a couple outreach workers, obviously from your HCH. It's a great place to start. And so the components, and we're going to have a couple of the other co-facilitators who've been outreach workers and homeless themselves speak to this in a minute, but as you see on the screen in front of you, there's several components. What we really like to do is, again, build relationships. People are often scared to interact with each other, and so we create a culture of humor, of laughter, where people get to know each other. We do facts on homelessness. One of my favorite activities in this is the stereotypes activity, where we openly brainstorm is what are the stereotypes of police officers? And then we also openly talk about what are stereotypes of homeless individuals. And what we find is a certain thing happens in that room where people kind of have this aha moment and realizing how those stereotypes hurt themselves and hurt the other folks in the room. We have a lot of storytelling. We actually have law enforcement officials paired up with homeless individuals that share their life stories. And in that process, again, people realize that there's more in common with each other than there are differences, and get to have a little more compassion of what the other person is going through. We have a team of outreach workers and social service providers who share about what's happening in the city, videos, and then again, one of my favorite is role plays where we have homeless individuals taking on the roles of law enforcement and law enforcement officials taking on the role of homeless and trying to figure out what to do if there's a homeless person found in the park at 2 in the morning by a law enforcement official. So just all these different dynamics really creates a strong chemistry that we found can shift the tone of interaction on the streets between law enforcement and folks on the streets. And now what I'd like to do, I'm very excited about this, is that there's two folks I worked with over several years. The first one is Carmón Ryals, who is a leader in the housing campaign at the Nashville Homeless Power Project, and she's now in Albuquerque. And I'm going to pass the phone over to Carmón.
Hello, everyone. My name is Carmón, and I'm here in Albuquerque. I was homeless on and off for 20 years. Now I just transitioned out of healthcare for the homeless, where I have Section 8 housing. And I'm really excited to be here today to be a part of not only healthcare for the homeless, but with Homelessness 101, and hope that we can get the ball rolling out here in doing workshops and word about Homelessness 101. I'm on the client advisory board out here, and I've been talking to the board about getting this started out here and what it's going to take. And they're really enthusiastic about Homelessness 101. So I'm looking forward to getting involved in it and taking it out there to the police cadets. One of my favorite parts of Homelessness 101 is breaking the stereotypes and being able to see people with humanity. You know, look at them and see really not just empathize with the police and how they do their job and what they're up against, but to really look at how the police break down and change their perception of a homeless person. You know, it's incredible. I remember a police cadet who was in one of the workshops we did in Nashville, and he was real defensive at first. And, you know, when we asked about, off the top of your head, we asked, you know, what do you think of when you see a homeless person? And he had some really derogatory and negative comments about homeless people at first. And, you know, then we reverse it and say, what, you know, when we see a police officer, what we think about them, you know, the first thing that comes to mind. And there's also some negative and derogatory words going out as well. But anyway, watching this cadet through the whole workshop was incredible because, you know, you could see his defensiveness start breaking down through the workshop as he interacted with us that were formerly homeless and homeless people. And when he was hearing the outreach workers speak and the social workers. And at the end of the workshop, he actually apologized for his defensiveness and his ignorance in thinking. He had tears in his eyes, and it really touched my heart, and it's something I'll never forget. Never forget. But, you know, I like the way that, of course, like I said, it changes the perspective of how law enforcement look at the homeless people and interact with them. And, you know, you also break down the circumstances of homelessness, you know, why people are homeless to the police, and it opens their eyes up and they realize, you know, what really is happening in this country and why we have so many homeless people out there, you know, whether they're vets or families or male, female, addicts, whatever. You know, people with mental illness, such as myself. It's really a wonderful program, and I hope to have the opportunity to get out there and do some workshops with some other healthcare for the homeless agencies and interact with you all. And with that, I'll give it back to Matt.
Thank you, Carmón. And now I'm going to pass it to Russanne Buchi-Fotré. Had many years working with her and coming to the Homelessness 101 workshop and just being an ally in our efforts around housing and other issues. And I'm going to pass it to her.
Hello, and greetings from Nashville. Yeah, my name is Russanne Buchi-Fotré. I worked at the downtown clinic, a primary care clinic for the homeless for many years, wearing many different hats. I facilitated the Homeless Advisory Committee, worked as a social worker, mental health specialist, was actually one of the original outreach workers, and did some recruiting of podiatry and eye care, housing, etc. But one of my favorite projects was my involvement with several of the Homeless 101 trainings with the Nashville Homeless Power Project. These trainings are truly interactive workshops, and if you weren't presenting, you were participating. I remember one particularly poignant training where we were asked to pair up, share our experience or interaction with a homeless person. I had many and shared my story. And then the cadet I was paired with shared about his experience with a homeless man. It was a very touching story. He had a favorite spot where he got his coffee every morning, and lately there had been a rather rough-looking man panhandling there, and it kind of become a source of inner conflict for him. He'd avoided him several mornings in a row, and then he just decided he was going to make a conscious decision to give him a couple of bucks, assuage his guilt, and be done with him. So he pulled up at the store that morning, got out of his car, quickly grabbed a couple of bucks from his wallet and rushed into the store, gave the guy the money, went in the store, got his coffee. He was waiting in the line to pay the cashier and felt a tap on his shoulder. And who should be standing there beside him but this disheveled bloke that he had given a couple of dollars to. Well, in his mind, how quickly things can happen, and he shared what had gone through his mind in the blink of an eye. This guy going to rob me? Dang, now I've opened the door. He's back for more, But the man gestured toward him, and in his hand he had a wallet, his wallet. Then he's thinking, God, this guy's already pickpocketed me, this stereotypical thinking. Well, the homeless man sort of leaned over and whispered to him that in his haste into the store, he had dropped his wallet. And the cadet, actually the civilian at that point, grabbed his wallet, opened it up, check and see if his credit cards and his money were still there. And when he saw that they were, he thanked the fella and left. This was actually the beginning of a relationship that spanned for over a year. He never gave the guy another dime, but he did invest time and energy into getting this fella stabilized, and it had been a true paradigm shift for him. And the next part of our exercise that day was to share and reflect on some of the stories that had been passed with each amongst ourselves. And his was a very significant and really moving story for the entire group. I'm not sure where this story ends, but my sense was that everyone gained some insight, and maybe there were some real awakenings in that. In Nashville, we have sort of our go-to officers that particularly sort of specialize in homelessness, and maybe this guy was just gleaned a leader from that training. I believe the first thing that these trainings do is to set a tone for the department. That they put a face on the homeless. They bring awareness to the officers of the struggles of these citizens that they face day in and day out. And then it brings the officers the resources they need to do the work, and a much more empathetic view as well. That the department's not just looking for wanting to assess criminogenic needs of this population, but there's more to what the department is invested in. I've heard it said that we have 3 homes: our bodies, which is our physical and spiritual self; our house, our place where we keep our things that have meaning to us. And for the homeless, this can be very transitory, if there's a space of that kind at all, something that we all have a tendency to take for granted. And then the third is our community, and the police department is a significant part of how the homeless and all of us actually view our communities. And for the homeless, sometimes that is whether they're feeling of rejection and being lost, or hopefully a journey to something better. And I just really feel like engaging and working with the homeless only makes for stronger communities. And I think that that's really the purpose of Homeless 101, is just kind of helping us to make those connections. And so with that, I'll just turn it back over to you, Matt.
Thank you, Russanne. In Russanne's sharing, it reminded me that Homelessness 101 was the only source for law enforcement in Nashville to learn what the resources were to help folks on the streets. That we provided our brochures, materials that gave contact information for the shelters, for permanent housing, for healthcare services. The officers and their seniors told us that they did not receive this information from any other source. And so we saw this as a critical avenue to really not just the most important piece, which was to humanize folks on the streets, but to also provide information. And it was often the starting point to get them to do that in a more systematic way. So how do you start this Homelessness 101 training in your community? You have most of what it takes right now. You have a network of folks who've been there on the streets before, who are organized, and you also have staff workers who may be interested in this. If you have at least 2 consumer advocates who want to engage in this program, say local law enforcement, but with Homelessness 101, and at least 1 staff person from your HCH, then that is enough to get this program moving forward. Obviously, you want to make sure there's nothing else happening in law enforcement. We found when we've talked to folks in other cities that there's often no other type of program. So that's a starting point. You will want to, within your organization, to do a decision-making process in which you can do with the National Council, several one-on-one phone calls to discuss if your organization, if your HCH is ready to initiate this program. There will be setting up a training team here that would talk you through both over the phone, but then be willing to come in for 1 or 2 days and develop a training for the trainers in your HCH, in your region, and go through not just a sample workshop. We would do a 3-hour workshop with you all, but then meet one-on-one with the individuals who would be in charge of it and really help coach you through that process, make you feel comfortable, and to practice that through a training of trainers. And then you're ready to start. And really, I think, as you probably all know, is that the way you learn best is by doing it. Our first Homelessness 101 was great, but with each one it got better and better. And we'd hope to be able to continue to stay in contact and offer consulting thereafter as your program develops. And with that, I will pass on to Melissa.
Thank you, presenters. Matt, Katy, Carmón, and Russanne. So I guess this is time for Q questions, actually. 2 great questions. They both go to Matt. I think I know the answer to these, Matt. So how do you document or measure the impact of the Homelessness 101 training of police officers? Matt?
Well, I have to tell you, this was a side project of the Nashville Homeless Power Project. Our main work was to do campaigns to increase the stock of affordable housing led by campaigns by homeless folks, and then we just saw this as a critical entry point. And so we were never able to do a systematic documentation. The way we knew it was because when we were on the streets, we'd see some of these officers who had been cadets, and the whole relationship was different than with many of the other officers. They knew our names, they knew the names of the leaders, and we'd hear stories about how they interacted with folks on the streets in a different way. Now, so we haven't done it in a systematic way. We're a grassroots organization that did this without any funding. I should let you know that in Nashville, law enforcement did not pay for this. This was a service that we offered for free to law enforcement, and we did not receive any grants for this program. So we were not able to do any further documentation, but they continue to ask us back for every single cadet training, as well as their park ranger training, for about 3 or 4 years. And it's not continuing now, but that's only because of a transition within the organization over the last couple of years.
Thanks, Matt. We have one more question, I believe, just one more question. And the question is is there a manual for the Homelessness 101 training?
That is in development. In fact, that's what this is a developing project of the council, and what we would do is take a lot of the workshops that have been utilized by the Nashville Homeless Power Project over the years and develop a more thorough training. And the idea is that that would go hand in hand with the training for trainers, that we would bring that to you and that you'd be able to utilize the manual, but then also be in the process of doing the role plays and trying it out for yourself first before bringing it to law enforcement.
Thank you, Matt. Thank you again to our presenters, Katy, Matt, Carmón, and Russanne. The final slide lists resources available on the web. Thank you for joining this webinar, again produced by the National Healthcare for the Homeless Council. Please also check out our website for information on our upcoming national conference in DC from June 23rd to 25th. This conference will include a workshop by Katy, Valesky, and Dan Rabbit on the Council's Community Health Worker Project, among many other exciting workshops. Again, thank you all for participating in this webinar. We look forward to responding to your questions through our website and our email addresses. Thank you. This webinar has come to a close.